Government Committee will come to order. The time is now 12:40. First up, we have Senate File 1858. Senator Mann, welcome to the State and Local Government Committee.
Thank you, Mr. Chair. Members, Senate File 1858 is the Market Bucks program. It incentivizes low-income Minnesotans to eat fresh, healthy foods by stretching their dollars when they do so. Part of this bill that's pertinent to this committee is that the bill will move the program from the Humanities Center to MDH. MDH is already doing a lot of complementary work like the SHIP program, where they partner with local grocers to improve access to healthy foods. They have been part of this conversation for a couple of years now and are ready to take this on. And with that, Mr. Chair, I'll turn it over to my testifiers.
Thank you, Senator Mann. To your testifier, Leah Gardner. Welcome to the State and Local Government Committee, and you may begin with your testimony.
Thank you, Chair and members of the committee. My name is Leah Gardner, and I am with Hunger Solutions, which is now a part of the food group. And what we have before you is building off of the long-standing success of what's more commonly known as the Market Bucks program, and expanding that model into more grocery stores. And more pertinent to this committee, we would like to move the current Healthy Eating Here at Home program, or Market Bucks, to the Department of Health from the Humanities Center. As you may recall, we unfortunately have had to defend the Market Bucks program from cuts more than once over the years, mainly due to questions about if Market Bucks is a fit within Humanities Center and the State Government Committee. In our role as playing an administrative role of this program, managing how we work with farmers markets, securing a match in federal dollars, et cetera, we have certainly appreciated the partnership with the Humanities Center, but we also agree that it deserves a more fitting home. As Senator Mann stated, we have met with the Department of Health several times and have confirmed that they have an interest in taking this on, both the existing Market Bucks program and expanding it through a Fresh Bucks pilot. They see it as complementary to their work, and we have also notified the Humanities Center of our intentions to move it, and they are in support as well. We feel like now is the right time to make this move, as we're looking to expand and grow our work, and are excited about the opportunity to work with a more fitting partner in the Department of Health. So we ask your support in moving this to the Department of Health. Thank you.
Thank you, Ms. Gardner, for the testimony. Members, any questions or comments to the author or the testifier? Senator Swedzinski.
I apologize if you said this, but this, why was this sent to Humanities in the first place? I mean, it just seems like that was not the best fit, and that this does seem, at face value, a much more appropriate agency to administer this. So I'm just curious why it was originally, if you even know the history of it. Maybe it's in the weeds somehow, but thanks for bringing this forward, and thank you, Mr. Chair.
Thank you, Senator Swedzinski. Senator Mann, any additional comments for the
I'll
committee?
have Ms. Gardner answer that.
Ms. Gardner?
Chair, Senator Swedzinski, it was before my time, but as I understand it, it was tucked away in a safe place in one of its many bounces around. So it was never, I don't think anyone wanted it to be in Humanities, but it just it landed there, and we've had trouble unsticking it for a while, if that makes sense.
Senator Swedzinski? No further comments. Senator Mann, any closing? Oh, Senator McQuaid.
Thank you, Mr. Chair, and thank you, Senator Mann, for bringing this bill. I had it in the past, and it's one of the most effective programs, and people really enjoy it. And so I want to thank all the folks who work on food insecurity and hunger, because it's not a problem that's going away, and your dedication and coming to the Capitol and really lifting up those voices is much appreciated. So this is a good bill.
Thank you, Senator McQuaid. Senator Mann, any final comments? Thank you for that, and seeing no further comment, Senator Gustafson moves that Senate File 1858 is recommended to pass and be referred to the Health and Human Services Committee. All in favor say aye. 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 All opposed say no. The motion prevails. Senate File 1858 is recommended to pass and re-referred to the Health and Human Services Committee. Thank you, Senator Mann. All right, members, looks like the next testifier, author of the bill, is still testifying in another committee. We will take a, no, we have Senator Johnson Stewart that's here. She has her bill coming up, Senate File 1903.
I don't think I have any testifying.
All right. Senator Ann Johnson Stewart, it looks like you also have an amendment to the
I
A1
do.
amendment.
Yep, Mr. Chair, I offer the A1 amendment.
All right, Senator Johnson Stewart moves the A1 amendment. All those in favor say aye.
Aye.
All opposed say no. The A1 is adopted. Senator Johnson Stewart, to your bill.
Thank you, Mr. Chair and members. Some of you know my history. For the last 40 years, I have been working as a resident engineer, we call it. That's the engineer that's out on a job site, working oftentimes right alongside speeding traffic, and have seen with my own eyes some very bad near misses or accidents due to work zone safety issues. So this bill just includes or requires the vehicle services to include a section or curriculum on work zone safety into the driver's license exam. I presented this bill already at transportation, and the DVS gave us feedback that they needed to know the timeline, so that's what the amendment addresses, is the timeline for implementation. Something I will just say as we're finishing up hearing on this bill, it's important that people understand that while a highway may be designed for 50, 60, or even higher miles an hour, so the curves and the sight distance are very comfortable. When we get into a work zone, some of the criteria shrinks down to like 25, which is why we see an excessive amount of accidents in work zones, especially around rear end collisions. So that's my bill, Senator.
Thank you,
Chair,
Senator
sorry.
Johnson Stewart. And it's your first bill testifying, first bill you've authored and testifying in this committee, is that correct?
I think so.
Yeah.
I've heard you're pretty tough, so I'm well prepared. I have pages and pages of documentation.
Members, any questions or comments to Senator Johnson Stewart on the work zone safety bill? Look, you have any final comments? Looks like there's no questions.
I don't. I think this is really important. I think we can't take work zone safety. I think we can't take the best practices for driving in a work zone for granted, especially for young drivers. We see an increased number or an increased representation of young drivers getting in accidents in work zones, and it can be pretty terrible. So I think this is a good bill, and I encourage your affirmation.
All right, thank you, Senator Johnson Stewart.
Oh, another thing, Senator.
Oh, yes.
I asked to go back to
Senator Johnson.
transportation, just letting you know that because of the change.
Okay.
Or I'm requesting
right.
that it go back to transportation.
So therefore, Senator, so seeing no further discussion, Senator Fateh moves that Senate file, is it 1903, as amended, is recommended to pass and re-referred to the Transportation Committee. All in favor say aye.
Aye.
All opposed say no. The motion prevails.
Thank you, Mr. Chair.
Yeah,
And
thank you.
committee members.
Thank you, Senator Johnson Stewart. And members, as the other two bill testifiers are in other committees, we will take a quick recess, and then we will return once they are done with their testimony in the other committees. Thank you. We have Senator Champion here to present on his bill, Senate File 2428. Senator Champion, to your bill.
Thank you, Mr. Chair. Thank you to the committee for your patience and understanding. Members, this proposal just fixes some drafting errors like the effective date and ensuring that the board established the minimum standards around texture education. And I understand that there's an A1 amendment as well, Mr. Chair. If we could have someone move that, that would be great.
Yep. Senator Champion, thank you for that. Let me pull up your amendment here. The A1 amendment, members, I think you should, we will be passing out the amendment to the members. Senator Champion, we will have Senator Carlson move the A1 amendment. All those in favor of the A1 amendment, say aye. Aye. All opposed, say no. The A1 amendment is adopted. Senator Champion.
And Mr. Chair, I have testified only if there are questions, not for anything other than that. Again, this is a bill that we passed last year, and there was just some corrections or modifications that we need to make.
All right,
Thank you,
certainly.
Mr. Chair.
And looks like there might be some folks remotely.
Yeah,
Is that correct?
I'm sorry, Mr. Chair. Yeah, we have a person, Myra Reedy, who's the Director of Government Affairs from the Professional Beauty
Okay.
Association.
Just to answer questions.
Just to
right?
answer questions.
All right,
And
thank
then
you,
we
Senator
also
Champion.
have Jenna Bowl, who's here just to answer questions. She's with the Minnesota Board of Cosmetology.
All right, thank you. Members of the committee, any questions or comments on the bill from Senator Champion, Senate File 2428? Seeing like that there's none. Senator Champion, do you have any closing comments on the bill?
Thank you. It just always strikes me as weird that I'm the one who's carrying all these hair bills all the time. You know, because if I had long, luscious lots like Senator McQuaid, then it would make sense. but I just want you to know it takes a long time for me to get this hairdo. I want you to know. So with that being said, thank you so very much.
Certainly. And I maybe just a general question. So do you see any changes for the cosmetology field and with how this bill might address that to the testifier?
Mr. Chair and members, that's a great question. We do hear from a lot of schools that they already have this curriculum within their cosmetology and hair technician courses. Of course, we don't know exactly how many, so this will require all of them too.
Oh, and sorry, you had to please state your name for the record.
Yes, Jenna Bull with the Minnesota Board of Cosmetology.
Thank you, Miss. And with that, we're looking to, Senator Champion, are you looking to move this bill to a different committee?
It is my understanding that it is supposed to, that our thinking is for it to be laid over for possible
okay.
inclusion to be a part of your omnibus bill, Mr.
Thank you,
Chair.
Senator Chairman. Sorry, we were moving bills back and forth. Seeing no further discussion, Senate File 2428 is laid over for possible inclusion. Thank you, Senator Champion.
Thank you, Mr. Chair. Thank you to the committee. I appreciate you profusely.
Welcome, Senator Rasmusson. Welcome to the State and Local Government Committee. Looks like whenever you're ready, you may begin.
Thank you, Mr. Chair. It's good to be back. Appreciate the opportunity to talk about the important work that direct care and treatment does on behalf of the state of Minnesota. And last biennium, there was legislation passed to set up a direct care and treatment agency as a standalone agency to pull that out of the Department of Human Services. And Mr. Chair, members, this is an idea that has been debated for years. It's been championed by legislators of both parties, and I think hopefully is a good idea to set up direct care and treatment as a standalone agency. One unique item in that legislation setting up direct care and treatment as a new agency was the governance model for this new state agency. Instead of having a traditional commissioner serving at the pleasure of the executive branch, what passed into law created an executive board of 7 members that would then select a direct care and treatment CEO. And the governor would not be able to appoint or remove that official. The bill before the committee changes back direct care and treatment's governance model to that of a traditional commissioner, but it also incorporates some really important changes, and we'll probably be talking about the A8 amendment here shortly, that are designed to preserve the healthcare independence of the work that direct care and treatment does. So just to underscore why getting the governance for this state agency is really important. Direct Care and Treatment has 5,000 employees. They have more than $1 billion biennial budget, and they serve more than 12,000 patients and clients a year. This is a large agency that does really complex work. And I'm just, Mr. Chair, myself and others have been concerned that a part-time board that's only required to meet 4 times a year cannot provide sufficient management oversight over this critical work. As this committee knows, sometimes you'll have those types of boards for small occupational licensing state boards, but a board structure of this type for an agency is simply unheard of in the state of Minnesota or in other states. Direct care and treatment does really important work, highly sensitive work that is important to the safety of Minnesotans. Nearly all of direct care and treatment's patients and clients have been civilly committed by a court. They're trusted in the care of the state because they have been deemed, in some cases, mentally ill and dangerous, or have been committed to the Minnesota Sex Offender Program. And I think it's also important for us to underscore that a part-time board should not ultimately be responsible for this very critical work. So, Mr. Chair, one of the ideas behind why we want to have a commissioner for this agency is to make sure that we're addressing some of the real public policy challenges that direct care and treatment has, whether it's been discussions about the 48-hour rule, about MSOP, about worker safety that we've read about in the paper recently, facility closure proposals. I think it's really important that we have a high amount of accountability at direct care and treatment while also preserving medical independence and leadership within the hospital. Mr. Chair, with that, I do have one testifier, and then I also have the A8 amendment, which I'm also happy to describe if one of your committee members would be willing to move the amendment.
All right.
Mr. Chair,
Senator Mayquade.
I will move the A8 amendment.
Senator Mayquade moves the A8 amendment. All in favor say aye. All opposed say no. The amendment is adopted. Senator Rasmusson to the amendment, to the bill as amended.
Thank you, Mr. Chair, and thank you, Senator Mayquade, for moving the amendment. And I did just want to, there's a lot of work that's gone into a few different amendments on this bill from both Senator Fate and encouragement from Senator Mayquade to make sure that we have a CEO position which would have clinical authority over direct care and treatment, would have to have qualifications as a practitioner of healthcare, and would not be allowed to be a political appointee in the same way that we would traditionally have a commissioner model. This also incorporates a lot of feedback that we receive from the Department of Human Services, direct care and treatment, and Minnesota Management and Budget. And so I do appreciate all the stakeholders who have had input in this. And Mr. Chair, just wanted to emphasize too that this is a very bipartisan effort. Direct care and treatment sits within the Senate Human Services Committee for its funding and primary jurisdiction. And I'm really thankful to have Senator Hoffman as chair of that committee, Senator Fate as vice chair of that committee, and Senator Abler as a former chair, all as co-authors on this bill. With that, Mr. Chair, I do have one testifier, and then I'm happy to take questions.
Certainly. Is it Mr. Kevin Magnuson, Washington County Attorney? Mr. Magnuson, welcome to the State and Local Government Committee. Please state your name for the record, and you may begin.
My name is Kevin Magnuson. I'm the County Attorney for Washington County. And I want to thank the committee for having me here today on this really important issue. It's important to county attorneys in particular for the very simple reason that when something happens at DCT, as it's going to happen, that there's someone who answers the phone when we call. You know, we had a constituent that spoke at a CLE, a continuing legal education training session, who talked about her son being in jail, waiting for months to get into a court-ordered psychiatric hospital. You know, and the whole time she kept saying, who's the wizard behind the curtain? Who can I talk to? I don't even know who's responsible. And this was after months of trying. And I think that's the main problem that you have if you don't stress the accountability that goes with having a person who is responsible and a person who's accessible. You know, a big part of the 48-hour rule, the priority admission legislation, is the themes of accountability and transparency. And I think that's for their sake, for DCT's sake, and for the people who are caught up in this issue of court-ordered treatment, being able to understand how a decision is made and being able to have information on your situation is critical. You know, they sit around a table at some point, the admissions people, and they make decisions about who should go where. There's a rationale behind it. And so, you know, what we've proposed is that they should be able to articulate that and get that information to the individual. So that's just underscoring, you know, our general position, my general position on needing to have some accountability.
Thank you, Mr. Magnuson, for your testimony. Members, any questions or comments to the bill? Senator Mayquade.
Thank you, Mr. Chair, and thank you, Senator Rasmusson, for continuing doggedly on this conversation. I will say, and I'm just going to illuminate for the committee members, this has been, Senator Rasmusson and I have been having a lot of conversations about this topic and this bill. I will share my concern has always been that a commissioner of direct care and treatment could be highly politicized. And, you know, there were a few examples that Senator Rasmusson gave in a very initial version of this where we were talking about if somebody was, you know, being housed in jail for a long period of time and needed transferred to DCT, and a news story could maybe do that. And I was like, but that's my fear, that the news could actually get somebody ahead of other folks. And then we had a committee hearing that involved some questions about funding for programs programs that are under DCT and expansion. And Senator Rasmusson leaned over and was like, a commissioner would be a really good person to answer this question here. And he wasn't wrong. And so this, with the amendment, kind of represents a lot of feedback. I'm hoping to depoliticize, because this is the only part of our government system where we are providing direct care and treatment, right? Direct medical care to constituents, not just paying for it, but like they are in our care. And so I really hope that that is the outcome here, that, this department, this agency is depoliticized, that we are able to run it like healthcare is meant to be run, but that we do have a person that is accountable for the decisions that are being made. A point that Senator Rasmusson made is, what if the CEO, blows $1 billion and the governor can't fire that person? And that's a fair concern. So I appreciate the work, and, hopefully we take some good steps, and we can always come back if it doesn't work out that way.
Thank you, Senator McQuaid. Members, any further questions or comments? Thank you, Senator Rasmusson, for working. Senator Drazkowski, or is it Swedzinski? Which one of you had your hand up? Swedzinski? No? Okay. All right, well, Senator Rasmusson, I just had a question about the implementation dates. Do you think that there would be a reasonable time frame, or is it addressed in the amendment here? Yeah,
Thank you,
Senator
Mr.
Rasmusson.
Chair. So if nothing happens, if this bill does not pass and become law this session, on July 1, this new direct care and treatment agency will going forward be run by this 7-person part-time board. And so by taking action this session, we will have that transition instead of to this board governance model, where the governor will be allowed to appoint a commissioner for direct care and treatment, and then under that commissioner, there'll be a direct care and treatment CEO who's already in place today and is running the day-to-day operations of the agency. So that's the implementation. It is a short time frame, but in some ways, it'd be a fairly simple fix. The bill is quite long, because we're basically switching from that executive board model to a commissioner model. There's just many references in the bill that have to be changed.
All right, thank you, Senator Rasmusson. Seeing no further discussion, Senator McQuaid moves that Senate File 626, as amended, is recommended to pass and re-refer to the Committee on Human Services. All in favor say aye. Aye. All opposed say no. The motion prevails. Senate File 626, as amended, is referred to the Committee on Human Services. Thank you, and with that, the committee is adjourned.